So after knee replacement, the way it's done today, most of our knee replacements are done minimally invasive with robotic navigation and same day discharge, meaning you come to the hospital and we do a peripheral nerve block, which is called an adductor canal block, to help with numbing the nerve that goes to the knee. So when you wake up from surgery, you're not having much pain, or you have actually a lot of patients have zero pain. And the most important thing to remember is that that knee needs to be used to stay active and healthy. So we need to start doing stretching exercises, bending and straightening exercises to maintain the range of motion of the joint, and strengthening exercises to start building the muscle mass as well. We want to prevent blood clots by taking aspirin and doing heel pumps and doing, again, flexion, extension exercises with the knee. And the dressings that come after the knee replacement, there's usually a ACE bandage that wraps around the joint that usually can come off on day 3 after surgery. There's deeper dressings that are water resistant. After you take the ACE bandage off 2 days or 3 days after surgery, you can shower and let the water run over the water resistant dressings, keep the area clean and dry. And then the silver impregnated dressings that are attached to the skin, and those are water resistance, can come off 2 weeks after surgery. There's going to be other layer of dressing inside composed of glue and steri strips that can stay until it falls off by itself. Do not put any creams or any ointments on the wound. Try not to touch the wound and keep it clean and dry. And then the exercises you want to do, the 3 most important exercises would be, if you can lay down next to me here, Kyla. And the first one is the stretch. So say that we did a knee replacement on the right knee. Go ahead and try to bend the right knee as far as you can. And slowly bend it more. Now, if it becomes painful, just hold there and just take a slow, deep breaths. Exhale the air out and try to relax the muscles. And then when you feel more comfortable, slide the seal a little bit closer to you again. And again, rest again. And now when you're resting, if you're having discomfort, your muscles are going to contract and become tight. So when you exhale the breath out, you want to relax all the muscles and prepare for the second stage. So exhale through your nose. And then again, deep inhale through your nose. And then bring that heel closer to you. And again, now if you feel tightness, exhale and relax all the muscles. And that's a little resting phase. And then with the inhale, there's awareness, there's pull more towards you, stretch that capsule. And then with the exhale, again, relaxation. You do that maybe 10 times or 15 times. Each breath brings your heel closer to you. And when we get to 90 degrees, that means we're in a safe zone, but we want to try to get the heel as close to the buttocks as possible. So we want to keep working until the range of motion on the surgery side is as good or better than the other side. Okay. Then the other exercise after total knee replacement to maintain flexion, if you can sit up for me, please. And then we don't have a prop, but if we have a book here and we can put the book under the heel, and then if you can put your palms right on your thigh here, both palms over up top of each and press down. And again here, when you inhale, keep that pressure. Now after knee replacement, sometimes the knee doesn't want to bend all the way. So we want to hold that pressure, maintaining straightness or extension of the joint. And with the inhale, press down, and exhale, relax the back structures. Breathing through the nose to help the muscles relax. With the inhale, pressing into straight knee. And with the exhale, relaxing the muscles again and repeating that cycle 10 times. So with those 2 exercises, we're going to regain the bending and the straightness of the knee. That's what the knee does. And then we do the straight leg raises. You can lay down for those. And those ones, you just touch my hand, hover just above the table, up and down. Go up and down, all the way down, and then all the way up. All the way down and all the way up. And 10 times. And by all the way up, that's misleading. We just want to be like hovering over. It's a little bit harder if you just hover and down. Good. We do that 10 times. And then we hold it up and pulse 10 times. Slowly pulse. And then we hold it and breathe. This is hard, but it's very helpful to get the oxygen flowing and the healing. And then we bring it down very slowly. So that's the straight leg raise. That will help strengthen the quad muscle and the VMO, bring the kneecap into better traction and help the healing, help the knee heal faster. It's important to do this exercise with the toes facing up and then also to repeat it with the toes facing out. So do the same thing up and down. So if you do it on Wednesday with the toes facing up, on Thursday do it with the toes facing out, so you can get both parts of the muscle engaged and stronger. Again, hover over the table 10 times. When you finish 10s, you do 10. And then you hold it up. And when it's shaking and you feel the burn, you put it down slowly. Keep smiling when you're doing this. So most commonly after knee replacement, after the wound heals, the pain is better than before surgery. Usually the wound is healing around 2 weeks after surgery. So that's usually the inflection point where the pain is better than before and keeps getting better and better. And after that 2 weeks, you're gonna feel basically regular improvement over the next few months. And most of the patients go to a 0 level of pain or a very small amount of discomfort. And that's talking about, for people with severe knee arthritis and having 9 and 10 out of 10 pain, usually the pain goes to 0 or 1 or some very low level. Most commonly, that's the outcome that we have. In terms of light activities after the knee replacement, in terms of recovering ability to walk, climb stairs, and do activities of daily living, you recover that immediately after the surgery. You're walking the same day after surgery, you're standing up, walking, and using the knee for activities of daily living. But in the beginning, there's gonna be some discomfort. The way we help that discomfort ease is with using the cold therapy, which is the circulating cold water to help decrease the inflammation, pain, and swelling. That helps the recovery significantly and decreases the requirement for narcotic pain medication. We also use some Tylenol, acetaminophen, and some NSAIDs. And sometimes we use a little amount of narcotic to help with the discomfort. Most patients can get along without using narcotics as well.